Welcome everybody. This is Jamie Sparks with Coordinated School Health. I'm in the Office of Next Generation Learners. We have several people here in the conference room with us, and as well as several that are viewing, and this will also be recorded so that it can be shared with other staff as well. One of the things that went out recently that Commissioner Holliday had sent out is on the initiative around the Kentucky Health Now Plan. And so one of the key parts of that, one of the key strategies is dealing with the Living Well promise through the partnership with Humana and Humana Vitality. So we have Jala Miller, who's account executive with Humana Vitality, here with us, and she's going to take us kind of through beyond the living promise and the health assessments and kind of what all is possible with the Humana Vitality program. So welcome, Jala, and the audience is yours.
Thanks, Jamie. Okay, so Jamie asked me to come and talk to you guys about kind of what's next after the Living Well promise. So Jamie, if I... Oh, okay, so I watch up here. Okay, got it. So I'm assuming that if you are in this room or in this meeting that you have probably completed your health assessment because you completed your Living Well promise. So I'll walk through just very briefly about the health assessment, just a couple of reminders, but more want to talk about, okay, I've done that, and what do I do next? So I'm going to log in on my account. Walk through that. Okay, so first, just high-level overview on My Humana in general. So you engaged in Humana Vitality a couple of years ago when we had the old site. You actually were transferred to a partner site when you clicked on Humana Vitality. But now, last December, we integrated, so everything's on the same page. So if you have a Living Well plan, you also have insurance through Humana. And then My Humana website, you can look at all of your coverage and claims information. And you can also look at your Humana Vitality. So you basically have two tabs on the website where you can access anything that you need to access. Coverage and claims is also a drop down up here. And then you have a Get Healthy and Earn Vitality points, and we'll walk through what's in those cover drop downs. But those are both Humana Vitality related. So two drop downs for Humana Vitality and one for coverage and claims. But when you log on, you should not have a notification here, like I do not have a notification here to take my health assessment because everyone has already taken their health assessment. So just want to remind you guys what that looks like. And under the Get Healthy tab on health assessment, that's how you get to it if you don't have a notification because you've already taken it. And you will see your actual age and your vitality age. And then you'll click on Get Started. And you guys are familiar with all the different categories here. We have fitness and exercise, we have your eating habits, your mental health, your lifestyle habits, and your physical health. So I won't go into detail about that. Like I said, I'm assuming everyone has already taken their health assessment. But I do want to look at kind of very next from there. So once I complete my health assessment, I get my vitality age and I get my personal health report, which just a disclaimer for you guys, I demo this all the time, so some of the answers are not 100% reflective of my activities. Just give you guys that disclaimer. The personal health report is where you can look at your vitality age and then all the answers and kind of a healthy range, not healthy range categories. And you can also print a PDF here if this is something that you wanted to take to your primary care physician and actually talk about your health assessment results. So starting that conversation about what we found is that a lot of, even if you do get screenings by your primary physician, you never actually know what your numbers are. a lot of people are saying, I've always been told it's normal, or I've always been told it's high or low or whatever. So this is a good way to start that conversation with your primary care physician so that you're more engaged in your health. You also have set goals or retake the health assessment. So you can click on set goals there, but I want to show you up here as well. You can start setting goals. And this is, again, what you see right after the health assessment. So this should be your next step. Or under Get Healthy, My Goals. So there's a couple of different ways to get to the goals section. But the purpose of the health assessment is to create personalized goals based on your answers of the health assessment and then your vitality check information if that screening has came in. So I'll show you guys where that is in a minute. But the next step after you take your health assessment is to look at your personal goals and decide what you're ready to work on. So what's cool about the Vitality program is that a lot of wellness programs say, okay, you need to quit smoking, lose 13 pounds or 50 pounds or whatever it is, and lower your blood pressure, and you have 90 days to do it. Good luck. But Vitality program understands that a lot of times as your health is concerned, you're not ready to work on necessarily all of those things. So you have all of your recommended goals. The formatting is a little bit weird for some reason on this because this is actually the learn coping skills is a recommended goal as well. But you can have anywhere from 1 to 20 some recommended goals depending on your answers to the health assessment. And you decide which goals you're ready to work on. So if you are only ready to maybe try to lose 13 pounds, which normally the losing weight is in increments, if you decide that's the only thing that you're ready to work on, you can set that goal. I'm not talking to anyone directly in the room, so stop pointing at yourself. So what the program has found is that instead of saying you have to do all these things and getting frustrated as soon as one of them doesn't start to work out, that you pick what you're ready to work on, and then usually once you see even some kind of success with that, even if you didn't completely achieve the goal, once you see some kind of success with that, that you're going to be motivated to go back and maybe activate another goal. Or maybe you didn't complete that goal, so maybe I didn't get my continue to be being more active, maybe I missed the workouts that I needed to. And it's just going to go back into a recommended goal for me. So there's no penalty for setting a goal and not achieving it, but I can try it again after the time period's over. So not only do you have the options of what you're ready to start working on, but there's no penalty if you don't complete something. That was actually one of the big questions that we got during open enrollment and during the Living Well Promise period, is that people thought that they'd have to complete their goals to qualify for the Living Well Promise. And the only thing that you had to do was actually complete your health assessment. So the goals and everything that we're talking about today is what you can do voluntarily above and beyond having completed your promise. So any questions about goals in the room, or is everyone have audio on the, okay, or in the interweb world? Okay, so personal goals are one way that you can earn points, and those are personalized to you. The other way that you can earn points is through standard activities. So I want to show you where you can see standard activities are just activities that are available to earn points for everyone. And under Earn Vitality Points, you can look at ways to earn. And I want to just show you, everything is highlighted here, but I just want to go over a couple of things. Obviously, the education category, you've taken your health assessment, you've earned points there. There's things such as CPR and first aid certifications that you can submit for points. There are online calculators, your risk of a heart attack, things like that you can do to earn points in the education category. For fitness, we'll go into in more detail. I think that's where there are a lot of questions, but verified workouts with different devices, and then we also have sports leagues and athletic events, and we'll go into detail on those. But what I wanted to show you is that prevention, your health screening. So if you are in the appropriate age category for a mammogram or a colonoscopy, you'll get points automatically when that stuff comes through claims. Also, your annual well visit for women will give you points as well. Flu shots will come in that way. Your vitality check that we'll talk about will give you points. And also prevention for dental and vision exams. So if you have Humana vision or dental and that comes through claims, it's going to automatically give you points for that. And if you don't have Humana vision or dental, there's a quick form, and I'll show you guys where to get the forms to get those points. And healthy living looks very similar, but it's more for your numbers being in range and not actually getting the test done.
What if you submit those for access card, like your vision or dental?
The question is if you submit your vision and dental through your access card, but they're not, you pay for them with your access card, but they're not Humana vision or dental, I believe you still have to submit the form for that because they're looking for a certain code that comes through on claims, and that's not going to come through if you pay with your access card. Yep. And then the last category is Vitality Kids. So a lot of stuff that adults are eligible for also fall into the kids category. They have their own health assessment. They have athletic events, sports leagues, preventative care visits, and all that kind of stuff too. So let's look at the vitality check, which is another very quick next step that a lot of people have already done. But the program has two basic baseline tests for you, and the health assessment is the online survey that you completed through your Living Well Promise, which is all self-reported data, and the vitality check is the verified data, where you actually get your finger stuck and you have your waist measured and all that good stuff to get your verified data that comes in through the system. And they have a question, is how do you claim points for blood work? Okay, so I think I'm going to answer this question when we're going through the vitality check. If I don't, let me know. So you have a lot of different options of where you can get your vitality check completed. For Frankfurt Associates, you have your first on-site clinics, and that's going to automatically upload to Humana Vitality. You also have Walgreens. Let me scroll down here so you can see. You have Concentras, which I think there's only one in Louisville, so that's not as popular around here. But you have the little clinic in certain Krogers, and you have Walgreens healthcare clinics. And you'll see that you can find a location on this page for all of those different places. And you can also take a form to your primary care physician. But all of the partner locations that we have are at no fee for you to go in and do that. And you might have a copay, or depending on what your insurance is, there might be some kind of fee at the primary care physician if you're going in for that screening. So just to caution you, if you go to one of the partner locations, there's definitely no cost to you. Also, we have partnered with the local health departments. About 90 of the 120 counties are covered, where you can go into a local health department and get your vitality screening as well. I know that the Franklin County Health Department is participating in that, so that's another option of where you can get that done. And all of our partner locations, except if you go to a primary care physician, you're going to have to submit a form. But if you go to any of our partner locations, that information is going to automatically upload. And then when we were looking at how you earn points, I think it actually tells you here as well, you will earn 2,000 points for getting your vitality check. So you're getting all four of these things measured, and then you'll get up to another 2,000 more depending on the numbers that are submitted. So depending on if your numbers are in range or not. And what happens there is that you get your points kind of up front if your numbers are in range, but if your numbers are not in range, you're going to receive a goal to work on those numbers, and then you'll receive points for achieving that goal and also for activities within that goal as you're working to achieve the goal. So you're going to get points either way with it, just depends on which route you end up taking. If you go to your primary care physician and get the test and want to submit, you can click on that vitality check form. And I'll also show you where the forms are later, where all the forms are housed together. And then you just follow the instructions on this form. You have to enter your member information. You have to have your doctor sign this form, actually, and put all the information from the screening, and then attach the screening results as well. So normally you get a printout. If you go to your doctor and they do a venipuncture, normally you get something in the mail within a couple of weeks, and you attach that as well as proof that you had your test done. Does it tell me who asked that question? There we go. Yeah. Ray. So Ray, does that answer your question? Fantastic. So the next area that we get a lot of questions about what's new next is fitness devices. So again, hover over the Get Healthy tab, and you'll click on Fitness and Exercise. And you can click on Start Getting Active, but I just want to show you kind of what is on this page to give you an idea of what you're looking at. So the reason that I have this here is because I have some devices that are already linked, and you probably won't see that originally because you won't have anything that's linked. But it's telling me how many points I'm earning from fitness devices. It's telling me what recent activity I've gotten from fitness devices and which ones I have linked. Giving me the option to find a participating Humana Vitality Health Club. So you can either use fitness devices. We have apps, we have pedometers, polar heart rate monitors, Garmin's. There are a lot of different devices that you can use. Or you can go to a partner gym location, and every time you swipe in, you're going to get your fitness points for that. So the zip code that you guys would like me to type in?
40383.
40383.
So you have. Snap Fitness. That's where I go.
So Snap Fitness is actually where, what's your name?
Marianne.
Is where Marianne goes. So Marianne, you should definitely go into your Humana Vitality account, type in that zip code, and then you'll see a couple different things here. It says Earn Vitality Points at this club and get directions. So if you click on Earn Vitality Points at this club, you will be prompted to put in your health club information down here on Connect Your Membership.
Okay.
So normally there's a number on whatever card that you scan in, and that's your health club member ID. You'll just want to make sure with your health club that you know what your member ID is, and then you put in your basic information. Here we go.
Okay.
And then you submit that. And then what's going to happen is your health club is going to receive a list of all the Humana Vitality members once a month, and then they submit activity that you've had once a month. So you won't see your gym activity every day coming up, but you'll see an upload. You'll know once the gym is submitted for that month and however many days you were there, you're going to get your fitness points each day for being there. So then let's say that when we looked this up, the health club that you go to isn't there. You can recommend a health club here, and you just need some basic information about that health club that you're already going to. And our gym network team will reach out to that health club and start the conversations with them about joining our network. So doesn't mean for sure once you submit here that they're actually going to be a part of the network, because there are some requirements of the gym. Sometimes, gyms aren't willing or don't have the capability to submit monthly activity if they don't have a swipe-in feature, or whatever it may be. But this will at least get the conversation started. And if there are a lot of people that you know that go to that gym, I'd recommend to have them all do it, because the more activity that our gym network is seeing for a certain gym, the more negotiating that they can go back to the gym and say, hey, you have a lot of members that are interested in this, so we'd really like to have you a part of our network. So I'm going to just go back to our fitness and exercise page, because we've covered health clubs, which is a great way to earn points. And you can actually, a lot of them will offer discounts as well. So they'll tell you if they auto-sync points or if they offer discounts, and they'll tell you what that discount is. So maybe you don't belong to a gym and you're looking for one, and you can see what kind of discount you can get through Humana Vitality by looking at that list as well. Well, we've looked at health clubs. So now I want to talk about athletic events and sports leagues. So that next triathlon that you're doing this summer, I'm not, but some people do. There are a couple different categories that you can earn athletic event points, and it just basically, the more activity, the higher the points. So a 5K is worth 250 vitality points, and then say you do a mini marathon that's worth 500 points. But you can see here how that's broken down. And then you can click to submit my athletic event, which will pull up another PDF or another form area. And you pick athletic event, and you can choose a PDF. You can also upload this pretty easily if you just submit the information for your event, that it was, it doesn't like me, but you can pick what kind of event it was, the distance, and then the event date, and you just have to submit some kind of proof. So I normally just take a picture of my bib if I've done a 5K, but you can also screenshot if your results are online somewhere and your time is there. You can screenshot that and use that as your proof. You can actually just have a picture of you at the event, and that'll count as your proof as well. But you have to have something verifying that you did it. You can run it or walk it. I have a coworker who says that it's not about how long it takes you to finish, it's about the fact that you finished. But she's done like, I don't know, 20-some 5Ks, and said that she only ran when someone was chasing her prior to starting Humana Vitality. She's jogged some of them, but it's not about how long it takes you to finish, it's just that you're doing it. So you don't have to be a super athlete to get started with points on this as well. And a lot of people start to really enjoy the 5K atmosphere because it's just such a fun Saturday morning kind of community activity. So athletic events are very similar as well. Sorry, I'm getting excited with the mouse here. There we go. I just keep taking you back to the same page so that you'll know where to go moving forward. But the form, the submitting for activity looks very much the same, and we'll go back to the submitting activity at the end. But sports leagues, such as if you're in a basketball league or a softball league, volleyball league, all that kind of stuff, I think you need at least 8 events, and you just submit your schedule basically for your team, and you can get points when that athletic event has finished. Same for children. So if you're any attendance under the age of 18, or doing athletic events, they can do the same thing and get points on a Vitality Kids basis. They just have to have a certain number of events, and I think maybe their coach has to sign their form. So, lastly, fitness devices. We talked about health club networks, we talked about athletic events and sports leagues.
Can I ask another question?
Yes, please.
Those devices that you referenced, like Fitbit,
Mm-hmm.
do they come with directions on how to sync them or?
Yeah, all of your fitness devices, the manufacturer is going to provide information on how to sync all of that, but what I'm going to show you now is how you make sure that you're getting points through Humana Vitality. So every fitness device is going to have Fitbit. You're going to go to Fitbit.com and create your account there, and that's what you're syncing to Humana Vitality. So every fitness device is probably going to have their own website and their own platform that we just pull the information from. But they're going to come with instructions, and Fitbit's actually really good. You basically plug it in, and it walks you through each step when you plug it in to register. So they're really easy. But we have a video here that I will not have you watch in this format, but you're welcome to watch it later to kind of figure out which fitness device is right for you, depending on what kind of activity you either like to do now or want to start doing. And then you're looking at fitness devices at a glance. So basically, you want to choose the right device for you, connect it to your Humana Vitality account, and then start earning points for using that fitness device. So you can click on Learn More About Fitness Devices or Shop Fitness Devices. So this is going to take you to the mall where you can actually get Fitbits and stuff like that within our mall. I'll show you guys that a little bit later. And you can learn more about fitness devices, which I think this is going to take you to a... Okay, so we have pedometers. We have a basic G1 and G2 Humana pedometers, which are normally kind of like the entry-level device that you want to use if you just want to track all of your steps throughout the entire day, and something that's not going to be using like GPS and draining your phone battery. You have to get 10,000 steps a day to get points with your pedometer. Fitness tracker, Runkeeper is the one that's primarily used with Humana Vitality. But the difference, so both the pedometer and the fitness tracker can track walking or running or whatever activities that you're going to do. But the fitness tracker is more for someone who's going to go out and set aside like 30 minutes and just walk at one time and not trying to get credit for their steps the entire day. Because you wouldn't really leave the fitness tracking device on all day because it would, like I said, use GPS and drain your battery. But if you know you're going to go out for a 30-minute walk, then you want to use that fitness tracker, and you have to burn at least 200 calories in a workout with a fitness tracker app. And then we also have heart rate monitors. So a lot of this gets into a lot of extreme detail about which device you want. Just want you guys to know that that information is there. You look like you have a question. So you can pick your device. And then you can click on Connect Device. And this is where you make sure that you're getting points for the activity. So when you click on Connect a Device, this screen is going to show you all the options of devices that you have to connect. And you'll see that I have connected my Fitbit because I have the option to manage my Fitbit device instead of here where it says Connect my Up. So I don't have an Up by Jawbone and I don't have it connected, but I do already have my Fitbit connected. So I'll show you. I believe it's just going to take you to the partner site. This is new.
Jala.
Oh yeah, then the Jawbone's new too. Yeah, it didn't used to be a part. So what it does is it takes you to a page to log in with that device's website. So if it's Fitbit or if it's Up or whoever it is, you're going to log in with your information that you used to log into that website. And then once you do that, which I don't have one for this, so I can't do that. But once you log in once, then what you're going to see from there is just to manage your device. And you're not going to have to do anything from that point forward. So you're going to have to sync your device however you normally do that, if it's through Bluetooth on your phone or if it's by plugging it into your computer. However you sync that, and you were sending it to Fitbit or Up or whoever it is before that, that's going to automatically start feeding to Humana Vitality now that you've connected the two devices. So you're going to be getting your points every day as long as you're syncing. Obviously you can disconnect, but why would you ever want to do that? So for users who have been engaged in Humana Vitality, we used to have a website called Humana Fit, and we used to have an app called Humana Fit, which is basically Map My Fitness with a Humana logo on it, branding. We have eliminated that extra step for members. You had to use to manage all of your fitness devices on a separate website, and we've integrated that into the Humana Vitality website, which is what you're seeing right now. But if you had previously used Humana Fit, I recommend to look at Humana Fit is here, but it's a disclaimer probably somewhere that it is going away at some point, actually the end of June. So I recommend to look into the Runkeeper app. It's free, and it functions very much like Humana Fit or Map My Fitness, and you connect it just the same way you put in your Runkeeper username and password, and your points will upload every day for that. And you can not just use running, you can actually, I use it to track my cycling, I used it for a hike this weekend, so you can pick what kind of activity you're doing, and then it tracks based on that activity. And then you can also look at your calendar and see what is coming in, which I was like, whoa, what happened? But it's the beginning of the month. So let's look at last month. I'll show you guys. So I wear my Fitbit every day, so I may or may not be getting points depending on if I get to 10,000 steps. But you'll see where I have some smartphone apps coming in, so that's Runkeeper or maybe it was Humana Fit. But this is good also so you can kind of look back and see your activity. Most of the apps and most of your devices will have a calendar too, but this is cool because you can see everything coming together. So all of your different fitness activities. Any questions on devices or fitness? Okay. So again, under the Get Healthy tab, covering all the high points, Vitality Healthy Food is a partnership that we have with Walmart where you can save up to 10% on all qualifying healthy food purchases at Walmart every time that you go shopping. So it's an automatic 5% savings, and it bumps you up to 10% if you've gotten your Vitality check. So we talked about the partner locations and where you can do that. Once your Vitality check feeds into our system, your savings bumps up to 10% instead of 5%. So how that works, I have already requested my card, but if I had not, when I came to this page, it would say something like click here to start saving. I don't remember exactly what the button is, but you basically click on that page. It takes you to a page that you verify your address, and they mail you the card within 5 to 7 business days. You don't have to do anything to activate it. You just have to start using it when you're at Walmart. And the way that process works, it is still kind of a new program. So some people get a little bit confused, and with just-in-time training, sometimes your Walmart cashier might be not familiar with the program if they've never seen it before. So there are actually instructions on the new cards that tell the cashier what they need to do to utilize that card. But basically, you let everything ring up, and then right before you pay, you scan your Humana Vitality card so that it knows exactly what you've purchased. And then you're not going to save anything that first trip, but within 5 to 7 days, all of the 10% or 5% of all of your healthy food purchases is going to be added back onto that shopping card. And then the next trip, you're going to save, say you spent $30 and you're saving 10%, so you're going to have $3 that comes off your bill the next time. So you're going to save $3, and it's going to continually save in that 5 to 7 day lag. So every time that you go in, you're going to save whatever you.
Is it all if you purchase the next purchase? Is it just all items?
$3 off the next purchase, regardless of what you purchase. So you can go in and purchase toilet paper. No, it's just not a healthy food, but you're going to get that $3 off if you had saved that much the time before.
I got one of those cards a long time ago, and it never did work properly. And I tried, and I ended up contacting Humana, which was a real pain to get through to somebody who could help me. And then I finally got through to somebody, and through email, I'm 2 million emails, to try to get, find out why the card wasn't working. Well, I think they
Scanned it wrong at Walmart.
I don't know what happened, but I think Humana cut off that first card, sent me a second card, and it's never worked. So I don't use the thing because it doesn't work.
Okay.
So I don't know what to do with it.
Yeah. Without being there at Walmart with you, it's hard for me to say too. What I do recommend for people if they're not sure that it's working is to make sure that the cashier is following those instructions, because generally it's not actually an error with the card, it's an error that the cashier doesn't know the steps to follow. So a lot of them will try to hit gift card. And gift card is not the right thing for them to hit. It's shopping card. It's a reloadable shopping card is what that Humana Vitality card is, and you just aren't loading anything to it. Humana is with those purchases. So I would make sure that they're following that process, and then if you look at your receipt, at the bottom of each receipt, you should see that barcode number on the bottom of your receipt, so below where your purchases are, and then if you've saved money, you'll see that savings come off. If you haven't, it'll just say $0. So on your card, the card that goes in your wallet, there are steps, and I would make sure that the cashier follows those steps, and then look at the bottom of the receipt.
I wish she ran it as a shopping card.
I wonder if she maybe did it and do it at the right time.
It's like the card is not, it's like it's not activated, or it's like it's not.
She should be able to go to her account and see it, though, right? If she has a card.
You should be able to go to the account and see it. Just like here, I can see that I've saved, so much money.
Well, I know
on
the site
purchases.
check to see what I had, it would always have 0.
Okay, maybe when we're finished, if you have time and you're still in here, we can actually pull up your site and see what's going on. But the healthy food program is one thing that there's just been kind of a lot of growing pains with that program, because it does involve another company that, we don't have as much control over the training or the understanding of the program. So I apologize for the experience that you've had, but it is a great program once it starts working, and it's a great savings opportunity. So hopefully we'll be able to get yours figured out. And as you guys can see, I've saved some money with. You can see your balance. So you have to actually go to Walmart to see the balance of what you're going to save next time. But you can see how much you've saved and the date that those savings were applied and what you actually saved. So let's go back to May. So this is what we'll look at on your account to see if anything has uploaded yet or not.
TDU Wi-Fi.
Okay, well I don't want to take too much time waiting on this to load, but it'll show the dates of the purchases, and then I can actually open it up and look at how much I saved on apples and how much I saved on bananas, and you can actually see each item there. Did it do it? Okay, yeah. So on this trip, I saved 14 cents with 2 purchases of bananas, basically. And you can see that on all of your different trips. And then we've talked about how to claim Vitality points. I've linked you into that, but I want to show you guys where it is. So under Earn Vitality Points, you can claim Vitality points. And we've already looked at this screen, actually, when we look at athletic events, but I just wanted to show you how to get there otherwise. If you a prevention activity, so if you don't have Humana Vision and Dental, but you're using your card to pay for that, this is where your prevention activity would be submitted. You can use the PDF, and you can mail, fax, or scan that in, or you can submit here and just attach your proof. For mammogram, colonoscopy, for some reason that stuff doesn't come through your claims system, and all those different activities. This is where you submit for athletic events, sports leagues, for children's sports leagues, for all those different activities. So anything that you need to submit a form for, CPR, first aid, all that stuff is here. And then, lastly, what you can do with all these points. So we met a gentleman, Mark, when we were at the Kentucky State Office building for a Living Will Promise tour in April, who his family had done his health assessment and basically gotten their biometric screening every year for the last 3 years. He had 30,000 Vitality bucks just sitting there that he didn't know what to do with. He had really no idea that he had this balance sitting there. So to give you guys an idea, this says that I have a 40% discount in the Humana Vitality Mall, but there are status levels, and that is because I'm at the top status level. But to give you guys an idea, at the bottom status level at bronze, when you just get started, that 30,000 Vitality bucks is worth $300 in Amazon gift cards. And at platinum status, with the 40% discount, it's worth $500 in Amazon gift cards. So he had quite the build up there, and obviously he was ready to start spending. But within the mall, you'll see that you have the option to shop with Vitality bucks. There are a couple of mall styles. You can actually shop with cash if you want to buy a pedometer, like right when you start out. And you can, some of the mall styles you can shop with bucks and cash combo. We have Amazon gift cards when you're looking at Vitality bucks, Macy's gift cards, Fitbit, Under Armour apparel, sporting apparel, pedometers. We have Apple products, so you can get an iPad. We had a coworker reading for an iPad recently. iTunes gift cards, movie tickets, cycling discounts, and Garmin and Polar devices, which are other fitness devices. One other thing that I want to point out, we do have a couple of options if you go into the cash option. You can save 25% at a Biggest Loser resort. So if you're interested in, taking a week off and going to do, I've heard that it's not as extreme as it is on the shows when people are there competing, but it's really good. It's a really good experience. You can save 25% just as a Humana Vitality member, 20% off fitness equipment at Life Fitness, and then I don't remember what the discount is for Seattle Sutton's Healthy Eating, but that's basically like where they send you your meals each week. I can't remember one of their competitors' names.
Jimmy Craig or
Yeah.
there's another one.
There's a Nutrisystem. Basically the same concept, so there's a discount there. Discounts for $15 off races that are part of this network, the Rock and Roll Network, and then you can get Sprint discounts as well. So these are all things that you don't even have to use Vitality Bucks for. That's just a discount for being a Humana Vitality member. I think let's see. Good question. So the question is, how long can you maintain your Vitality Bucks before they're lost, and how often does your status start over? So your Vitality Bucks are good for 3 years. So if you earned a point when we launched Humana Vitality January 1st, 2012, that will expire January 1st, 2015. Next year is when you start to see points roll off. But the way that it works is first in, first out. So if you're making sure that you're spending your points within that 3 years, even if you have some bucks, they were probably earned later. But each buck is good for actually 3 years. So sometimes I accidentally interchange points and bucks, but points are what you use to get your status level to go higher. I'm hoping that this is, yeah. Show me the status points. I want to give you guys a visual. If you'd like to take a survey, we're not going to do that right now. I'm going to encourage you to do it if it pops up for you. Wait here. Okay, this will be good enough. So your status starts over at the beginning of each plan year. So the KEHP is on a calendar plan year from January 1st to December 31st. So next year, if you get to December 31st, you make it to platinum status. Then what's going to happen when your program renews is that you're going to maintain your platinum status as far as the mall is concerned, because it's just like an airline rewards program or a hotel rewards program where you get to keep you have to re-earn your status every year. So you're going to keep your platinum status as far as the mall is concerned. You're going to keep that 40% discount, but you're actually going to be returned to blue status as far as your just what you have earned that year. And once you take your health assessment, you'll be back in bronze, and then you have to re-earn for a single person, it's 10,000 points to get back to your platinum status each year to keep it for the next year. You actually have 10% of the points that you earned the year before that will roll over. So right now I have 1,500 points that are 15,000 points that I've earned this year already. So I'll have 10% of those automatically next year as kind of like a booster to start me out to get me going. Then I'll get points for my health assessment. Some of my biometrics, if they were in range last year, they'll roll over to the next year. So you'll have a base of points to kind of get you started, but then you continue with your goals. You continue with fitness activities and those kind of things to re-earn for the next year. Does that make sense?
Any other questions out there? I think that's the only one that's been typed in. Great. Well, thank you, Jayla. We appreciate your time. For those that are listening, we will make this link available. You can share with other staff, and then we'll send it out to people want it as a resource and get it posted up. So thank you very much.
Thank you, guys.
And thank you all.